Hi, I'm Carrie. I'm a physical therapist, and we're going to work on thoracic rotation today. So our thoracic spine is 12 vertebrae that sit in the middle of our back from about the base of my neck to about where the bottom of my rib ends. And I have 12 thoracic vertebrae. There's 5 lumbar vertebrae, and there's 7 cervical vertebrae. So my thoracic spine equals the same amount as both my cervical and my lumbar vertebrae. Often, because of our posture, we tend to sit like this while we're driving, watching TV, eating, anything that we do in front of us. And it's really important that we have good posture, and often this gets really tight in the middle of our back, and that can cause problems with neck pain and back pain. So if you have neck and back pain, chances are the middle of your back is tight too. And this will actually be an evaluative tool, but also the way that you would treat it. So the first way I like to ask people to do it is laying on their side with their knees bent up as tight as they can to their chest, their arm out straight. You can put your palm facing the floor, and you're going to take a big deep breath in, and then you're going to breathe out, and you're going to reach all the way back to the floor. Now, when I first started doing this, I was so tight that I got to about here. That's how tight my middle of my back was. And with just some work on this, I also saw physical therapy and chiropractor, I was able to get myself all the way back to the floor. And then each side is a little bit different. So one side's tighter than the other. The more advanced way to do it is with one leg straight and one knee bent. And I can use a block or a foam roller. This is a half foam roll to just rest my leg on, breathe in, and then breathe out and reach all the way back. That's a little bit tighter that way, but I still can go pretty far. And I have people do 5 repetitions to either side. And this is called bow and arrow. You can play around with your breathing patterns. I can breathe out first and then breathe in as I go back, or I can breathe in first and breathe out as I go back. And by working on either side, it helps to keep the mobility of my spine. So if you tend to play a sport where you're always twisting to one side, or you're sitting at work and you're always twisting to one side, this is a good exercise to do to really make sure that you have the same mobility on each side. So breathe in and breathe out. And this really stretches all in the front and all in the back. By keeping my knee bent, I protect my lower back because a lot of rotation does occur there, but it should also occur in my thoracic spine. And so by having my knees bent, I lock out my lumbar spine so the rotation can happen where it needs to happen a little bit higher up. That's why oftentimes we get back pain, because the rotation's happening in the wrong place. So that's one way of just increasing a little bit of thoracic mobility, and it also helps with your posture as well, and just the tightness that we get from sitting day to day. Thanks. Have a great day.